Welcome to The World Today. I'm Waqas Majid Khan. Today we have a very distinguished panel of guests in our studio. Let me introduce them. First of all, we have Ahmed Salim Saif Al-Mandhari. He is the Regional Director of WHO, which is a UN organization. He is visiting Pakistan for the first time, and we are very happy to have him in our studios. He's joined by Nima Abid Said. He's the country head for WHO and in Pakistan, and also working on polio eradication. And we have Zafar Mirza Saab with us. He's the Director Health Systems of WHO and is based in Cairo. Welcome to Pakistan and welcome to the show, sir.
Thank you very much.
Dr. Ahmed, I'd like to start with you. It is your first visit to Pakistan, and you also met the President of Pakistan today, who also happens to be a doctor. So tell us a little bit about your interaction with him.
Yeah. Thank you very much. Before I start, I'd like to express my sincere thanks and appreciations to BTV World Channel for giving us the chance. Answering your question, it was my great pleasure and honor, in fact, to come to Pakistan in my first visit as Regional Director of WHO for Eastern Mediterranean. It was my honor also to meet the President today, which we had a very good discussion for health-related issues in Pakistan and at a global level. As you know, Pakistan is a very key and active player, not only at a regional level, but at a global level. Several of the initiatives that have been introduced to the WHO at a global level came from Pakistan. And whatever successes that are made at healthcare system in Pakistan will definitely have an impact at the regional and global level. So the discussion with the President was around these areas, like, for example, the polio eradication program, the fight against non-communicable diseases, and the different programs and frameworks that the country is really trying to do. And one of the discussion points that we have raised and shared together is the country strategic plan when it comes into the health, national health strategic plan. WHO is a very strong and partner and supporter to Pakistan, and inshallah we spare no efforts to support Pakistan and its healthcare systems through the three levels of WHO: country level, regional level, and headquarter level.
Okay, I'll come back to you for more questions, but right now let me ask Dr. Nima. He's been here in Pakistan previously as well, and you worked for the polio eradication campaign. What is your assessment of the work that has been done up till now? Do you think it is on the right path? Do you think we will be able to be polio-free soon?
Yeah, absolutely. I mean, the work in Pakistan was impressive. I mean, numbers speaks. I mean, we had more than 300 cases in 2014. Now we are speaking about 8 cases this year, 8 cases last year. But we have to remember also we are speaking about an eradication program, which means 0. So with all this progress, with all this impressive achievement, still we are not yet there. But I am very optimistic. Optimistic for many reasons. Pakistan have one of the strongest surveillance system, very sensitive surveillance system. Not only in a human, we are looking for the virus. We are looking also for in the sewage for the virus, polio virus in the sewage as well. And this system is supported by state-of-art laboratories. I mean, the laboratories in the NIH, polio laboratories, are one of the best in the global polio network of the laboratories. And they are serving both Pakistan and Afghanistan, not only Pakistan. All the samples from Afghanistan being tested and is being tested in Pakistan as well. The other thing which makes me optimistic is the level of commitment and that the government and putting on polio eradication. There is, I mean, just last month there was a steering committee chaired by the Prime Minister of Pakistan, attended by Chief Minister of the provinces. There is very strong coordination mechanism, which is Emergency Operations Center, which is under the government leadership, and all other partners under that. So it's one team under one umbrella. And then if you go to the district level, the program is actually run by the whole government. It's not health only.
So how soon do you think Pakistan will be polio-free?
I think, I mean, 2019 ideally should be, but latest should not be more than 2020 because, I mean, there is no option. Now Pakistan and Afghanistan, the only 2 remaining countries reporting wild polio virus. So there is no option actually to be, and we having 8 cases in localized area. there is a strong possibility. But we have to address the remaining challenges. We still have some performance issue at the lowest level. I mean, polio can be eradicated at the village level.
Right.
We need really more engagement of the community themselves, people themselves in the process. And we need to work a lot on improving, I would like to say, essential immunization. It's called routine immunization, but now in KP province, in Khyber Pakhtunkhwa, they call it essential immunization, which I like it more than just routine.
It is essential.
Yeah.
Well, Dr. Zafar, let me ask you about this new term that is being bandied about, and that is to prevent people from using tobacco and sweet, sugary, carbonated drinks, and it's called the sin tax. Do you agree with this term?
Well, thank you very much, Majid, for having me. It's always a pleasure coming back home. I'm from Pakistan, working in World Health Organization. And to come back at a time when the new government has given a new vision and a new action plan for 5 years, which is very much in sync with the international standards of public health and of World Health Organization. Well, as far as your question is concerned, the sin tax is a terminology which has become very popular, although it is a misnomer and it should not be used. I think the better terminology should be health tax, and health tax on those products which have, for which we have evidence of having negative effect on human health: tobacco, alcohol, sugary drinks, excessive trans fatty acids, containing diets.
What about junk food?
Junk food, etc., fast food as we call it. So it's not the term names. It should not be called at sin tax. It should be called rather in a positive way, health tax. But the key point is that there is now evidence world over that when the prices of such products are taxed, I mean the prices go up, the consumption go down. So they will have, you minimize the chances of these products having negative effect on human health, but at the same time, by putting more taxation, you also generate more money, and that money can be recycled back into health. That we call earmarking for health. So it's one thing to actually put tax, but also another to actually making sure that what revenue you are generating by putting additional taxes also used back in health promotion and for health protection of the people.
Excellent, sir. Dr. Ahmed, we also have an issue with the amount of resources that we allocate towards the health sector. Pakistan being not a very rich country, our GDP ratio for health is very, very low. Is the WHO working with the Pakistani government in increasing the amount of GDP that we spend on our health? Is there any program that's working on that?
Yeah. To be honest, this is a challenge to many, many countries around the globe. It is not only Pakistan, you know. The spending on health is really sometimes very minimal. That will not help countries to fulfill their community expectation. Pakistan now, with the new vision, as Dr. Zafar mentioned, they have a plan to increase the share for health, you know, from that minimal budget to a very promising, you know, amount of money and budget allocated for health. Definitely that will have a very positive impact when it comes into the health outcomes, the availability of the services, and at a primary, secondary, and tertiary level. WHO works with member states, you know, when it comes into guiding the countries and advising the countries how to spend it and on what basis that they need to increase their budget based on the indicators of that country or that member state, you know, identifying the trend of diseases and how is it going on for the coming few years, and how much money that is really needed in terms of real money or in terms of the staff and the human resources that are required. So that is most of the support the WHO is giving to member states.
Excellent, sir. And Dr. Nima, you've been working here, you worked for the polio program, but there are other health issues in Pakistan. Tuberculosis is one of them. We have very high infant mortality rates. Maternal health is also an issue. So what exactly is WHO doing to help Pakistan in these sectors?
Yeah, we are working very closely with the government and with the Ministry of National Health Services regulation and coordination, and with health department at the provincial level. As you mentioned, tuberculosis, for example. I mean, tuberculosis is, I mean, Pakistan is fifth top the burden of disease of tuberculosis. And we are missing almost, estimated 170,000 cases, and we have also multi-drug resistant tuberculosis. But the program is taking steps mostly of detecting cases, investigation of the cases, and providing a treatment and making the treatment available. And tuberculosis is one of the diseases that we have opportunity because it is absolutely curable disease. I mean, it's not like other diseases, which is, once you detect early and treat properly, then the disease will be completely cured, and the chance of infecting other people will be minimized. So the same for other communicable diseases. So we are working closely, and as mentioned by the regional director, really the new action plan is completely aligned with the regional office plan, and which make it even more easier for us to work in more harmony with the government and achieving the health goal in Pakistan. Pakistan, we have many challenges. We admit that we have to, but at the same time, we have many opportunities and the potentials. I give you the example of recently concluded measles campaign. The government with the partner, they managed to reach 38 million children in 12 days. They achieved more than 90% coverage with, actually 93%.
That's incredible.
With injectable vaccine.
Wow.
So to me, when there is will, when there is strong preparation, when there is fund available, Pakistan have all the potential to catch up quickly with
Well, that's really good to know. We should hear more of these feel-good stories, actually. Dr. Zafar, there's a very strong link between the environment and health. And they always say that prevention is better than cure. So what is your opinion on the state of the sewage infrastructure in the country, and what kind of a role does that play in the overall health of the nation?
Yeah, thank you. Thank you for asking me this very important question. Generally, it is thought that health is the responsibility only for Ministry of Health. Whereas now we have a very convincing evidence that there are services which are to be supplied by Ministry of Health, and there are services which needs to be provided by Ministry of Health in collaboration with other ministries, Ministry of Education, Ministry of Water, Ministry of Industries, Ministry of Transport, Ministry of Agriculture, and the list goes on. Why? Because it has been proven that unless we also address the risks to health, not just diseases, but risks to health, and risks are of two types: behavioral risks and environmental risks. Behavioral risks are those which you are responsible for. If I start smoking, there is a chance that I will have lung disease. So it's my behavior which, but environmental risk is air pollution, which is not in my control, and yet it has a huge effect on. In our region, we have estimated that in 22 countries, 25% of morbidity is due to air pollution. You cannot ignore it. So as a result, we call it intersectoral action for health. So we are currently working, and we will be working with the government of Pakistan also on this, because the first priority of the current government in their national 5-year national action plan is providing universal health coverage. Now, universal health coverage means that everybody must have access to essential health services, and they must not go under financial hardship when they fall sick, and if you are poor, you must not be denied the health service. So this is universal health coverage. But when we say essential health services, what kind of essential health services? There are health services which are purely directed at attacking diseases, and there are health services which must be provided to also address those risks, environmental risks and behavioral risks, and those risks must be addressed through intersectoral action. So this is why we are promoting the idea of health in all policies.
Right.
We are talking about whole government approach, and our regional director has actually given a new slogan, that is health for all, by all. Everybody has a share to make in order to promote health. It can't be just left to one organization or one ministry or one institute. It is everybody's responsibility. So determinants of health, whether they are social determinants or economic determinants or even political determinants, they need to be addressed alongside addressing the diseases themselves.
And that's very important, sir, and I hope that that takes some traction in Pakistan. Well, Dr. Ahmed, tell us a little bit about the family practice program that you've been talking about earlier when I was talking to you before the program. What exactly is this family participation or practice?
Yeah. Going back to the point Dr. Zafar raised about the universal health coverage, and also taking you back to the year 1978, during Al-Ma'ata Declaration, in which member states at that time, they said the only, for the target of health for all by the year 2000, the only way for having that target done by the year 2000 is through the primary health care. Now, they discussed a lot of options for primary health care, and they found that maybe the best option to make sure that we are really providing a very comprehensive healthcare service, that each member of the community, either a child or an adult, a male or a female, needs, is through well-prepared, technically speaking or clinically speaking, and trained healthcare providers, I mean physicians, which they call them family physicians. So the concept of family physician came into the field in order to make sure that we are really providing a service that fits the needs of every member state. So family physicians are a member of a team, big team, which is called family practice concept, in which a family physician, well-trained other members of that team like nurses, physiotherapist, health educator, pharmacist, lab technicians, are providing a service to a patient, led by the family physician. So the family physician is a well-trained physician that can care for all members of the family at a certain level, and then after that, he may or she may refer to the specialist for further care.
All right. Well, let's see how that's going to work out in Pakistan, because we are mostly a rural, mostly agriculture-based rural community, and a lot of people don't really have the concept of family doctors as such. They just go anywhere they can get the service. So that needs to develop. Of course, let's hope that it does. Well, let's also talk about the strategic priorities of WHO, specifically in Pakistan. Dr. Nima, can you shed some light on that? What exactly are we trying to do?
Yeah, I mean, the overall strategies, first of all, as it was mentioned, universal health coverage, which means accessibility to quality care and financial protection that provide access and with financial protection. So each one, and to me, this is social justice. I mean, each one have, even the poorest of the poor, have the access to quality care as anyone who is wealthy or rich. This is, to me, the first step, to provide services to the people. Second priority is protecting people during emergencies. And Pakistan is prone for natural and man-made emergencies, as well as outbreak of communicable diseases. I mean, epidemic-prone communicable diseases, being leishmaniasis, being dengue fever, being many other emergencies. And the third one is health promotion. I mean, because health is not only merely the absence of disease, it is mental, physical, social well-being.
Absolutely.
So it's this how WHO define health. So health promotion, which include maternal child health, include non-communicable diseases and others. And the fourth priority for us in WHO, how to enable WHO office to deliver effectively, to make the, to help the government in achieving or addressing the health challenges in this. So this is, and now this is actually, to me, the main point in WHO transformation. I mean, the three level of the organization of WHO, I mean, country office, regional office, and headquarter, all of them with one main objective is how to show impact at the country level.
Which is basically delivery to the people.
Exactly.
Absolutely. Well, Dr. Zafar, if you could also talk about the National Action Plan for Health that is now being developed by this government. I believe it's for the first time, it's in line with the SOPs and objectives of the WHO. How did that happen? Why did it take 70 years to be in line with WHO, and shed some light on that, sir.
Thank you for asking me this very important question. We are having this discussion at a time when a new government in Pakistan, in few months in office, they have given us a 5-year action plan for health. Never before in the history of this country, such radical program for health reform has been introduced. And I'm saying this as a World Health Organization representative sitting here, also as a Pakistani sitting here, who has looked at the evolution of health sector in this country over the last many decades. So there is absolutely no question about it. But what is very interesting is also that World Health Organization at the same time has recently adopted a new program for next 5 years globally, and we call it General Program of Work. This is 13th General Program of Work. So it is very interesting, and we were enjoying this fact this morning when the Ministry of National Health Service Regulation and Coordination officials and Minister of Health gave us a presentation about their National Action Plan, that the strategic priorities of the government's National Health Action Plan are exactly aligned with World Health Organization strategic priorities. And what are these? These are 4: universal health coverage, protecting people from health emergencies, investing in people's health and well-being, and institutional reform. WHO itself is doing this. We are promoting this to our member states, and Government of Pakistan on its own has come up with an action plan which is exactly the same.
Well, that's wonderful news, sir.
And we are very excited about it. And this morning we have already agreed on number of projects, number of plans. One good thing which also has happened after the devolution which took place in Pakistan in 2011, the health sector got very fragmented at federal level, but that has been put back under the preview of the Ministry of Health, Ministry of National Health Service. And currently all rural health service and urban health service and public health and all other important public health institutes at federal level have been put back into the authority of the National Health Service. So we have agreed with the federal government this morning that in Islamabad Capital Territory, we are going to collaborate with them and help them and facilitate them in developing a new model of care which is primary healthcare based, which is going to strengthen our basic health units, rural health centers, health houses, and by investing in them and also by converting our physicians and GPs who are sitting in these facilities, by giving them one year training, which WHO is going to do that in next couple of months, and convert them into family physicians, which Dr. Ahmed was mentioning. So that will actually be the basis of a new family practice based primary health care, and also we are going to ensure that there is a proper referral system, that once a patient comes to basic health unit, then if his or her disease so required or condition so required, only then that person will end up in hospital and nobody will go directly to the hospitals. Because the reason is that we have estimated that around about 80 to 90% of health problems can be tackled at primary health care level. But ironically, governments over the years, not just in Pakistan by the way, everywhere, have invested more in tertiary health care, building big hospitals and ignoring the basic health units and rural health centers and etc. So time has come, and I think government is realizing fully that unless we strengthen and invest in our primary health care, we are not going to achieve universal health coverage, and we will keep clogging our tertiary level big hospitals. However big and good and specialized they are, they cannot handle our population of patients which will be directly ending up in hospitals.
Right.
So we have actually agreed with the government, and we are still in process of discussion with them, that how we can actually support the national 5-year program for this government, and it is in everybody's interest, and there is no option to see this becoming successful program.
Absolutely, and I hope that the citizens of Pakistan also help and support you in this endeavor. Unfortunately, this is a subject that requires many programs that we need to do subsequently, but right now we are out of time. But I would like to take this opportunity to thank you, Dr. Zafar, Dr. Nema, Dr. Ahmed. Thank you so much for taking out the time and sharing your views with PTV World.
Thank you.
Thank you very much.
Thank you very much for having us.
Well, you take a short break. We'll be right back. And when we come back, we'll be discussing the United States has, for a change, praised Pakistan for promoting Afghan peace talks. We'll talk about that. Take a break.
Let us, as members of the United Nations,
of moonless nights, when handed a night bereft of its glittering pendant, I decided to grow my own moon. So the spirit is no more hostage to the hide and seek of a wandering celestial being. That is but a deceptive glimmer of hope, a mirage that lures the wayfarer to lose his way and embark upon a quest for the elusive. I stole the glow from selfless souls, added the void within my being as dark spots, rolled into a concoction. The night.
Welcome back after the break, and now we've been joined by Javed Jadoon Saab to talk about this very interesting development where the United States has said that it welcomes Pakistan's efforts to promote peace talks between the Afghan government and the Taliban. Thank you very much, sir, for being here. What do you make of this acknowledgement, sir? Because first we had the do more mantra, not doing enough. Then we had the letter that was written by Mr. Trump to Prime Minister Imran Khan. And now we have some other indications that things are actually moving towards some kind of a solution there, sir. What's your opinion?
Thank you very much. I think the Americans have tried almost everything in Afghanistan. They have used the military power, military force, and every weapon available has been used in Afghanistan to suppress the Taliban movement. We have seen that spending over $1 trillion on war efforts in Afghanistan in 1.5 decades time. America has not been able to achieve the targets they set for themselves to defeat Taliban and set up a government which is a stable government in Kabul and which can be run ultimately without American or their allies' support. This has not happened in Afghanistan. Now, I think the options they have got very limited options. Option number one is to continue with the war efforts over there. And I think the generals in Washington have realized that they can't win the war in Afghanistan. Given the track record, how they have been facing the kind of difficulties they have faced in Afghanistan, and the resilience of Taliban forces over there. Taliban control more than 50% of the territory in Afghanistan, and according to some other sources, they control 65% of Afghan territory. In cities, in the daytime, they control, and the rural parts of the country and the mountains are being controlled by the Taliban. Taliban have launched many daring attacks in Kabul as well, and even against some of the most fortified military complexes over there. So I think this is about time President Trump, who has been very unrealistic as far as Pakistan's role in the region and in resolving the Afghan conflict was concerned. The kind of statements which were being emanated from Washington were really disappointing for Pakistani policymakers, that despite the fact that we offered unparalleled, unmatched sacrifices in the fight against terrorism, because over 75,000 lives lost in Pakistan.
Those are just official figures, sir. In fact, unofficially, they're much more.
Much more than that. And despite these sacrifices, our efforts were never acknowledged by Washington, or particularly after President Trump came into power. So coming back to this particular point you raised, that why now? I think it's only because they have tried everything in Afghanistan. And the only option, I think even from the beginning, this option should have been exercised involving Pakistan. And what Pakistan can do is to facilitate the dialogue process between Taliban and Afghan government, and they can bring them together on the negotiating table, and then it is up to the warring parties to talk about the conditionalities and how they can come to a conclusion that you need to end the war over there. And the only condition, Vikas, which Taliban have been putting forward is to quit Afghanistan, go back, and then we can talk about peace. So I think ultimately the issue, the conflict, the long war, or probably the longest war in the history, is going to be settled through negotiations.
So what do you think about Mr. Khalilzad's efforts in trying to foster peace in Afghanistan? He's been jet-setting all over the world, gone to over 8 countries, and meetings with the Taliban, with Pakistan, with UAE, with a number of other countries in the region. What do you make of his efforts, and do you think that they are going to bear fruit in the coming months?
Because I think there are many stakeholders, but I think the key lies with Islamabad. Without Islamabad's active participation and facilitation, I believe you can't bring about peace in Afghanistan. But I think Pakistan's concerns need to be addressed as well. When the talks continue and
that realization has now finally set in?
I think, I believe that they want to involve Pakistan just to reach a kind of a settlement with the Taliban, so that they can leave Afghanistan with some dignity and honor they have left with. But I think Pakistan's concerns are also very serious. Number one concern of Pakistan is to stem the Indian influence in Afghanistan. And we know that only yesterday we observed the anniversary of Army Public School massacre. And we know that the footsteps are leading towards New Delhi and the RAW. I think it's a very serious concern on part of Islamabad, Vikas. We need to talk about these concerns as well, because if Indians continue to have a foothold in Afghanistan, peace will never return to that war-torn country, no matter what kind of negotiations you initiate. Secondly, the cross-border terrorism. We do know that in many instances we have traced the footsteps back into Afghanistan. Afghan soil was used to plan, execute, and launch terror attacks inside Pakistani territory. In many instances, we do have the intel. I think we need to address that issue as well. If Americans are willing to address those issues, I think only then you can reach an acceptable solution to the long conflict, which has definitely, I think, Probably thousands in Afghanistan have also died because of this particular this conflict, and even Americans' lives have been lost. So I think Pakistan needs to stress the point that these concerns have to be addressed by the negotiators.
Well, Shah Mahmood Qureshi, the foreign minister, also made a statement. He called upon the Taliban to lay down their arms and talk about peace in Afghanistan finally. So many observers feel that come next year, by the middle of next year, there are hopes that peace would return to Afghanistan. But what is the nature of that peace? Are we looking at some way in which the Afghan Taliban and the Afghan government will meet and find some kind of a rapprochement? Or what do you see as the contours of that peace?
Because I have a different view what the foreign minister said. I think Taliban are negotiating from a position of power right now. They are controlling most of the territory over there. Why should they lay down arms now? When you dictate your terms, then you have to dictate the terms. Laying down arms never happened in the past, and it will never take place even in the future. Taliban will never lay down their arms. They will negotiate, and they are very, very shrewd negotiators as well, Vikas. They will sit on the negotiating table, they would put forward their terms and conditions, and I think the first and the foremost term and condition would be that the Americans should leave Afghanistan, and then they can talk with the Afghan government in Kabul and reach an agreement which is acceptable to the Taliban, to the government of, to the Kabul government and Americans as well as Pakistan.
Right. We've also been joined by Raja Kaisar in the discussion. Thank you very much, Raja Saab, for making it. Raja Saab, we also have a comment coming from China when we hear about the peace process that is moving forward in Afghanistan. China has also pledged to help Afghanistan and Pakistan overcome long-standing suspicions and explore possibilities for engaging the Taliban. What is your comment on that?
Well, thank you, Vikas. See, this Afghanistan right now is kind of a mutual concern for all the regional players, because the kind of threat which emanates from Afghanistan spills over the entire region. Unless and until there is not sustainable peace there in Afghanistan, none of the countries in the region can have the long-term stakes within the region. Reason being because right now the most ubiquitous threat which they are facing is IS, which has emerged as to be a joint threat for Pakistan, India, China, Russia, all of the countries, all of the regional players. So that's why China's gravest concerns regarding peace and stability in Afghanistan are very obvious. Plus this non-state actor terrorism, it has its own niceties. It will not leave any country into peace. If some country is not affected today, you never know the kind of the attitude of these non-state actors. They may target any other country in the coming future as well. So all the countries, they have to think into the preview of their national interest. Unless and until Afghanistan is destabilized, Americans are there, you cannot expect to have a kind of a roadmap to the solution to the quagmire or to this imbroglio which Afghanistan is facing right now.
Absolutely. We also have a statement coming in from Zabiullah Mujahid. Judun Saab, if you would like to comment on that. He said that representatives from Saudi Arabia, Pakistan and the UAE will also be participating in the peace talks, and the Taliban are now very seriously considering these peace talks. So that gives a lot of hope that we might be walking on the path to peace. As you mentioned earlier, that the Taliban say that the presence of international forces in Afghanistan is the main obstacle to peace. But at the same time, not many are comfortable with the Americans just moving out lock, stock, and barrel and just leaving it, without any rudder. What do you think about that, sir?
But Vikas, I think now the policymakers in Washington, particularly at the Pentagon, they believe that it's about time to cut loose and run. They have, as I said at the outset, that they have tried everything possible in Afghanistan. Every kind of weapon has been used over there, the daisy cutters and the mother of all bombs, etc., so on and so forth. The carpet bombing of Taliban at the initial stage when the campaign started in Afghanistan, B-52 bombers flew over Pakistan and they did the carpet bombing over there. I think because they have done everything they could have done. Now what else they can do? To negotiate, have a face-saving kind of agreement with them, and just leave Afghanistan. But as for the song of, the famous song, Hotel California, the Eagle song says, that you can check in any time, but you can never leave. So Afghanistan is a kind of a place where you once set your foot in, then I think circumstances will allow you or don't allow you to leave. They are, I think, in a very precarious situation. And now I think they have understood that the importance of Pakistan in the whole process of negotiations. And if Pakistan can play a role, it should be acknowledged as well. Pakistan should be given credit for that. But unfortunately, every focus is towards New Delhi. New Delhi is India is a big market, but Pakistan has offered the kind of sacrifices.
I think we're seeing a failure of that policy. That policy has now failed. That's evident from what we're seeing.
It is evident.
Things on the ground as they're moving forward. One last question, Raja Saab. The Taliban have also, showed a recognition, or maybe have said that there will be a mutual recognition between the Afghan government and the Taliban, and they're also willing to talk about constitutional changes, and women's rights can also be negotiated. So these are also positive steps.
This time Taliban movement, or the way the landscape of the Taliban is way different than it was in the 90s. Now they are very well privy to the changing dynamics of the region. They know how to calculate their preferences. They know how to negotiate. They know how to bargain. They are very circumspect and they are very prudent at this point of time. Plus they also know that they are negotiating now from the point of strength. They have more or less 60% direct or indirect control or influence over Afghanistan. So at that time, any expecting Taliban to come out to lay down arms or to come out with surrender or instrument of surrender is absolutely a far-fetched proposition.
That would be naive to even think.
Yes, it will be absolutely unrealistic. What Americans had done a fatal mistake in this entire part was that wherever they have destroyed the basic fabric of the state, there had been an outright chaos. If you see, that had happened in Iraq as well,
Libya.
That had happened in Libya as well, that had happened in Syria as well, and that had happened in Afghanistan as well. Americans need to know a fact that there is no replacement to nation state right now in this world. You'll have to recognize Afghanistan as a nation state. You will have to sanctify it as a nation state, and you will have to authorize them to find a solution for their own. Unless and until Kabul administration acts and stands as a client regime of Washington in Afghanistan, you can't expect this, and you can't work out simultaneously with peace and turmoil. You can run with the hare and chase with the hound. This policy Americans had been trying for long.
We'll leave it at that because we're completely out of time. But thank you very much for coming and sharing your point of view. Well, you heard the conversation, and in the end, we like to say, please make your own conclusions from what you've heard. And on that note, it's goodbye.